Hi everyone, welcome back. Today, we're diving into muscular dystrophies, a group of inherited disorders that affect skeletal muscles, leading to progressive weakness and degeneration. Let's walk through the key types, the genetic background, and what you need to know from a nursing perspective. Let's start with the big picture. Muscular dystrophies are inherited disorders. That means they're passed down through families, and they cause progressive degeneration of skeletal muscles. These diseases vary in age of onset, which muscles are affected, and how fast the symptoms get worse, but they all involve some degree of weakness, wasting, and disability over time. Now, the most common and most severe type in children is Duchenne Muscular Dystrophy, or DMD. DMD is caused by a mutation in the dystrophin gene, which is found on the X chromosome. This means it's inherited in an X-linked recessive pattern, so boys are almost always affected, and mothers are usually the carriers. Dystrophin is a protein that helps keep muscle cells intact. Without it, muscles break down more easily with use. Let's talk about the signs and symptoms of Duchenne. First signs usually appear between 2 and 5 years old. Kids might show delayed motor milestones, things like walking later than expected or having a clumsy gait. One of the hallmark signs is Gower's sign, where the child uses their hands to climb up their thighs to stand because of pelvic muscle weakness. You'll also see calf pseudohypertrophy. Their calves look big, but it's not muscle, it's fat and scar tissue. Over time, they'll develop progressive muscle weakness that leads to wheelchair use by around age 12. Cardiomyopathy and respiratory failure are common causes of death, usually in the 20s to 30s. Now let's contrast that with Becker Muscular Dystrophy, or BMD. This one is also X-linked, so again, mostly boys are affected. But it's a milder and slower progressing form. Becker patients still produce dystrophin, just an abnormal version of it. Symptoms often start in adolescence or early adulthood, and they may not need a wheelchair until much later, or not at all. Now let's move on to a group of muscular dystrophies that are inherited differently, the autosomal dominant ones. The most common here is Myotonic Dystrophy. This one is unique because it affects skeletal muscle and smooth muscle. That means you can see weakness, but also issues with organs and other systems. For example, patients might have facial weakness, droopy eyelids, and slurred speech. They can have myotonia, delayed muscle relaxation. So after shaking your hand, they can't let go right away. You might also see cataracts, cardiac arrhythmias, insulin resistance, and even infertility. It's inherited in an autosomal dominant pattern, so if one parent has it, each child has a 50% chance of inheriting it. Another autosomal dominant form is Facioscapulohumeral Muscular Dystrophy. That's a mouthful, so let's break it down. Facio means the face, scapulo is the shoulder blade, and humeral refers to the upper arm. So this type typically affects facial muscles first, then the shoulders and arms. It often shows up in the teenage years, and it progresses slowly. These patients may have trouble whistling, smiling, or lifting their arms above their head. And finally, Limb-Girdle Muscular Dystrophy. This group includes many subtypes, and they can be inherited in either a dominant or recessive pattern. These types cause weakness in the hip and shoulder muscles, the so-called limb girdles. It's highly variable in severity and age of onset. Let's wrap up with some general nursing care principles. There's no cure, but physical therapy, bracing, and respiratory support can improve quality of life. Monitor for complications like respiratory failure, scoliosis, and cardiac dysfunction. Support the family with genetic counseling and long-term planning. And be mindful that these conditions often require a multidisciplinary team: neurology, cardiology, pulmonology, PT, OT, and palliative care. That's our overview of muscular dystrophies. Each type has its own presentation, but they all involve progressive muscle weakness and need thoughtful, compassionate care.